Okay, everybody, so this is going to be a real short one. This is the last lecture that you're going to have to sit through with me. We're going to do a Zoom tomorrow and Thursday, and we will have the test on Friday. Okay? So, tomorrow I sent you a review sheet that you need to do, and you need to do it the best of your ability. It's this one right here. Um, it should be a pretty good representation of what's going to be on this test, okay? Um, you know, as I look through this, these keywords, these 5 keywords, these are easy. If you're thinking like me and you're going to talk about making a multiple choice test, you need to look at these slides and think what are easy multiple choice questions, okay? And so, um, if you can't answer some of these questions, then those are the slides that you definitely need to study. Okay. Um, this pressure stuff, intrapulmonary and intrapleural. If you don't know which is which, you've got to get that figured out. Intrapulmonary, intra-lung pressure, intrapleural, which is the pleural space, intrapleural, that space pressure. Okay, 4 millimeters less. Okay, apnea, not breathing, dyspnea, abnormal, Boyle's law, atelectasis, pneumothorax, okay? All these different type of things you need to make sure you know. Shouldn't be a big thing. And then we got this whole thing here when we talk about acidosis and alkalosis, okay? In fact, why don't I go back here to this here. So this is easy. This right here is easy multiple choice questions, okay? Or true false, all right? This whole thing here, we talk about hyperventilation and hypoventilation, and we're talking about if we are breathing too rapidly, too much carbon dioxide is vented out. All right, so bunches of there's not enough carbon dioxide, right, to make the acid, so we don't get the carbonic acid, right? So it results in alkalosis. If we don't have the carbon dioxide around and we're blowing it off too quickly, that means we're not able to make this acid, which means we're going to be too basic, right? And so then we stick that bag over our mouth, and we blow into the bag, and we breathe some carbon dioxide to get that level down, to increase the acid production, to take us back to a normal pH. The other part here is if it's too slow and shallow, we have too much carbon dioxide sticking around, we become too acidic, and therefore that messes up everything as well. And we're going to see that in people with COPD, chronic obstructive pulmonary disease, asthma, where the airways are collapsed down due to inflammation and smooth muscle contraction, obesity, trauma, pneumonia, anything that is going to not allow good airflow in and out of the lungs. Okay. And then these disorders, I mean, you can bet money that I'm going to ask questions on all these. These are easy questions, right? So don't get them messed up. Okay, chronic bronchitis, emphysema, so lack of alveolar recoil, right? And so with the pressure high, the walls collapse. When the walls collapse, we have less of those little air sacs, which means we've lost surface area. All right. 4 features. Okay. Most of the time in emphysema, we have a smoking history. Now, like I said, it'd be interesting to know if that was secondhand smoke in there or if it was just smoking itself. All right. Dyspnea, air hunger due to dysfunctional breathing, coughing, and pulmonary infections, and respiratory failure, hypoxia, acidosis, whatever, blah, blah. Okay. Your lung cancer, you know, they have a history, a smoking history, metastasizes very quickly due to the vascularity of the lungs. Okay, all the blood that we have ends up going through the lungs at some point. highly vascular. So if you start getting a rapidly dividing cell in there, and that thing is making cells and it's some slough off, it's easy for it to get caught up in the bloodstream and just to travel, and then it's going to lodge somewhere. Could be a bone, could be um, it could be in a breast, it could be anywhere, and or a brain or a heart or where it can get lodged somewhere, and then it starts to replicate and replicate and replicate in somewhere else. Okay, that's your metastasis, and that's what you're kind of seeing. It's in a tissue. It's in a tissue. It breaks through into the blood vessel. Now it travels. Okay, and then we got all over the body. Make sure you understand with these different types of cancers where it is that they normally see them. Okay, this one's got bleeding in the cavities, right? This one is in the periphery and the alveolar cells and the glands. And this is in the primary bronchi. And so the primary bronchi are underneath the sternum, so that's why they'll say it's clusters in the mediastinum, right? Very aggressive. Okay, and the other part is to remember when we talked about the trachea, we talked about the left and the right primary bronchi. One's more vertical and bigger. So if you're going to swallow a marble, you're going to end up finding it there. Okay, anyway, blah, blah, blah. Those treatments. Cystic fibrosis, that's another big one that you're going to want to know. Okay, and that is a genetic thing. All right, so if both are carriers, there's a 25% chance. Now, if you tend to not have it in your family history, you probably don't have it. You can be tested for this, but I don't know if I would necessarily put that on the qualifications of if you're going to find your future mate, that you won't marry them or you won't go on a third date unless they've been genetically tested for cystic fibrosis. I wouldn't go there. That's just me. Okay. All right. So we've got that. We've talked about how cystic fibrosis does affect the lungs. However, quite a bunch of other stuff. SIDS, sudden infant death syndrome, asthma. We talked about the hyperbaric chambers. Okay. And we talked about partial pressures and solubility of gases and all that kind of stuff. And so, these hyperbaric, these are increased pressure chambers. And so they're driving oxygen into wounds and bodies and things like that to help with oxygenation, right? So if vessels are damaged, people with gangrene or diabetes that have bad vessel or poor blood circulation, then that can be helped with a hyperbaric chamber, right? We're going to force oxygen into these tissues, into the cells, so the cells can work and function and heal the way that they're supposed to. So I'm not going to go over all those. So just as we go through, you got your basic, quiz 1 is your basic anatomy of just structures. What's there and what do we call it? Okay? Then we have the second quiz is more of the physiology portion, right? So what it does and why, all right? So you've got these things. This is basically the second quiz. You need to know this. You need to know how and why air is moved in and out, this whole external and internal respiration, and then we've done this kind of with transporting things around. Yeah. So anyway, like I said, I don't have a lot to do here, but this is what you need to have done by, it'd be good by tomorrow. But what we'll do is we'll spend Wednesday and Thursday doing a Zoom around noon, or maybe even earlier. I'm not sure about Thursday. We'll have to see about that because I have some stuff I got to do. But for tomorrow, for sure, we'll do around noon or so, noon, 12:30. I'll send you out a thing, and we'll do a Zoom, and we'll get all this stuff answered, and we'll talk about it. And if you have a question, you make sure you ask, okay? And then Thursday, if we need to, we'll do another one. If not, we don't have to. I mean, I can make myself available in the evening, maybe on Thursday, for some final questions before the test, and then we'll do the test on Friday, okay? Again, if you do not have your quiz corrections in, then I'm about done taking them. It should be in by now. If you haven't had other stuff turned in, I'm about ready to say done with it. So if you don't have it turned in, I'm about done. So get it done today. If you have stuff lingering out there that has not been turned in, it better be in today. Okay? Otherwise, get this thing done, and we will get Zoom tomorrow, and we'll get this answered, which will give you credit if you show up for the Zoom meeting. Okay? All right. This was short today, I know, but we're pretty much wrapped up. So you guys have a good day, and let me know if you have any questions. All right. Bye.